everyone, my name is Liza Thantranon, and I am the Regional Counsel for Health at Legal Services of Northern California. We're a nonprofit legal aid organization providing free civil legal services to low-income people in 23 Northern California counties and health consumer services in 32 counties. Today, I'll be giving an overview of the Medi-Cal and in-home supportive services programs, focusing on how older adults can become eligible for those programs, and also discussing how older adults can utilize the benefits in those programs, particularly for long-term care needs. So my training goals for this session are to give you a general understanding of the Medi-Cal program and how eligibility works. 2, an overview of the long-term care benefits covered in the Medi-Cal program. And 3, an overview of the in-home supportive services program and the benefits it provides. So we're going to get started with Medi-Cal first. First, what is Medi-Cal? Medi-Cal is a free health coverage program for low-income Californians. Every state receives federal Medicaid funds to implement a healthcare program for low-income people. California uses a combination of federal Medicaid funds and state funds to create Medi-Cal. So Medi-Cal is California's version of the federal Medicaid program. Next, let's talk about how to qualify for Medi-Cal. Historically, you have to have low income, low assets, and qualifying immigration status to qualify for Medi-Cal. A lot of those rules are actually changing in the next few weeks. Effective January 1st, 2024, there will be no asset limit and no immigration status required to qualify for Medi-Cal, meaning to qualify for Medi-Cal, you just have to be low income. For purposes of Medi-Cal, that means under 138% of the federal poverty level, which is $1,677 per month for a household of 1 in 2023. I also want to note that there are certain categories of people who can have higher incomes than 138% of the federal poverty level and still qualify for Medi-Cal, such as kids and people with disabilities, but I'm not going to get into the nitty-gritty details of those specific programs today. So just know that generally folks have to be under 138% FPL to qualify for Medi-Cal, but there are some exceptions. So what does Medi-Cal cover? Medi-Cal covers medically necessary services across a broad array of benefits that includes physical health, mental health, substance use disorder services, prescription drugs, dental, vision, and long-term care. Medi-Cal also covers some ancillary benefits such as transportation to and from all Medi-Cal covered services, including medical, dental, and mental health appointments. And Medi-Cal also provides intensive case management called ECM for folks with complex needs, and a suite of benefits under the new CalAIM initiative. The benefits available under CalAIM vary based on the county and the managed care plan, but can include services such as housing navigation, housing deposits, housing tenancy sustaining services, medical respite, short-term post-hospitalization housing, and personal care and homemaker services, to name a few. So switching tracks to how people actually receive these services, the majority of Medi-Cal benefits are delivered by commercial Medi-Cal managed care plans such as Anthem Blue Cross, Kaiser, HealthNet, etc. Mental health and substance use disorder services are provided jointly by the Medi-Cal managed care plan and the county behavioral health department. And then lastly, prescription drugs are covered by a statewide system called Medi-Cal RX. I delineate which entity is responsible for delivering each benefit because that's important to know if you have an issue with accessing benefits. If you need to file a complaint, grievance, or appeal, you need to do so with the entity that's responsible for providing that particular benefit. And that leads me into my next slide, which is what to do if there's a problem with Medi-Cal. For eligibility issues, such as being denied or terminated from Medi-Cal, folks have a right to a state fair hearing and must request one within 90 days of the negative action or notice. And for service issues, such as denials of care or delays in accessing care, folks should request an appeal with their Medi-Cal health plan within 60 days. After the plan level, you can also request a state fair hearing. This is also a good point at which to contact your local legal aid organization. They can assist with eligibility and service access issues and represent clients at state fair hearings. Okay, so we're going to move on to long-term care Medi-Cal. It's the same Medi-Cal program, but there are some special rules when it comes to long-term care. So what long-term care services does Medi-Cal cover? Medi-Cal pays for nursing facility services for individuals who need skilled nursing care or rehabilitation services. I want to note that Medi-Cal does not pay for room and board expenses in assisted living facilities. And jumping into the special rules for long-term care Medi-Cal, the first one is called spousal impoverishment. Basically, this rule is intended to prevent impoverishing the spouse who stays at home when the other spouse needs to go into a nursing home. So spousal impoverishment rules allow the spouse at home to keep all of the income in their own name and an allocation from their spouse's income up to a maximum monthly maintenance needs allowance, which is $3,716 per month in 2023. I know this sounds a bit confusing, but we'll go over an example in a minute that will make it more understandable. Before we do that, I also want to talk about Medi-Cal estate recovery, which is a rule that allows the state to recover the cost of long-term care services from a Medi-Cal beneficiary's estate after their death. So nothing happens during the person's life, but after they pass, if they received long-term care services from Medi-Cal, the state can recover the amount of benefits paid for them or the value of the person's estate, whichever is less. So that means if you leave nothing in your estate when you pass, the state can recover nothing. We don't have time to get into the details of Medi-Cal estate recovery in this training, so just know that this rule does exist, and if you have a patient with this concern, you should encourage them to seek advice from their local legal aid organization for extra detail. Okay, so we're going to look at some quick examples, starting with Mr. Mozzie in case study number 1. Mr. Mozzie is an 82-year-old patient who has been diagnosed with dementia. He lives alone and does not have any friends or family nearby who can come over to help him around the house. He currently has Medicare and receives $1,550 per month in Social Security retirement benefits. He has about $100,000 in savings, which he draws from regularly to supplement his monthly income, but he has no other assets. So is he eligible for Medi-Cal? So as of November 2023, the asset limit for one person is $130,000. So Mr. Mozzie does fall under that asset limit, although that asset limit is going away as of January 2024 anyway. So the only thing left to look at is whether Mr. Mozzie is under 138% of the federal poverty level, which is currently $1,677 per month for a household of 1. So the answer is yes. Mr. Mozzie's income and assets are under their current limits, so he does qualify for Medi-Cal. Looking at his options for long-term care, it looks like he might need to enter a nursing home if a clinician determines he needs skilled nursing care. Otherwise, he might be able to remain at home with just in-home care services, which we'll talk about next. Okay, case study number 2. Your patient, Amanda Lorian, needs skilled nursing care. Her husband, Mr. Lorian, doesn't think they can afford the cost of a skilled nursing facility. He is also worried he won't be able to afford the rent at their current apartment without his wife's income. Mrs. Lorian receives $4,000 a month from her pension. Mr. Lorian is still working and earns $800 a month. They have $180,000 in savings. And we're asking, is Mrs. Lorian eligible for long-term care Medi-Cal? And are there any options for Mr. Lorian to receive additional financial support? So let's look at Medi-Cal eligibility first. Again, in 2023, the asset limit for a couple is $195,000. So the $180,000 they have in savings is under the asset limit. But remember that asset limit is going away as of January 2024 anyway, so that wouldn't be an issue in the future anyway. In terms of income, there's not an income limit for long-term care Medi-Cal. All of your income goes towards the cost of your nursing home care, except for a $35 personal needs allowance. So if we were looking at just Mrs. Lorian alone, she would pay $3,965 of her monthly pension amount towards her skilled nursing care. Medi-Cal would pay the rest, and she would get to keep a $35 personal needs allowance. In this case, without spousal impoverishment rules, Mr. Lorian would be left with only $800 per month, while Mrs. Lorian's income went directly to the nursing home. Fortunately, Mr. Lorian does get to take advantage of spousal impoverishment rules, so let's look at how that works. So in the left column here, we have Mr. Lorian's $800 of monthly income from his employment. He gets to keep that because that's in his name. Now looking at the right column at Mrs. Lorian's income, you can see how her $4,000 pension payment gets allocated. Mrs. Lorian can allocate $2,916 of her income to Mr. Lorian to get him up to that $3,716 limit, which is called the maximum monthly maintenance needs allowance limit, which I know is a mouthful. And then the remainder of her income, which is above that limit, is $1,084, and that goes directly to pay her nursing home. Okay, now moving on to our overview of the In-Home Supportive Services Program, or IHSS. So IHSS is a statewide program that provides low-income people with in-home care services to help them remain safely at home as an alternative to being placed in a nursing home. Here's a list of services IHSS provides: domestic and related services such as meal prep, cleaning, and laundry, personal care services such as bathing, feeding, dressing, and grooming, paramedical tasks such as injections and bowel and bladder care, transportation accompaniment to medical appointments, and protective supervision, which is monitoring for people with cognitive or mental impairments to prevent injury. Who's eligible for IHSS? Folks can get IHSS if they are on SSI or Medi-Cal, they are blind, disabled, or over 65 years old, and they're living at home and they're unable to continue doing so without supportive care. So let's talk about the process for actually getting onto IHSS. Step 1 is to submit the IHSS application to the County Social Services Office. Step 2 will be the needs assessment, where a county social worker will make a home visit to assess the applicant's needs. Step 3 is submitting the medical certification form, also called the SOC 873. This is a form completed by the applicant's healthcare provider. After that, the applicant will receive a notice of action that approves or denies the IHSS application, and if approved, awards the number of service hours per month. From there, the person needs to hire an IHSS provider, or sometimes multiple IHSS providers, to work the number of hours they've been awarded. And then once someone is on IHSS, their needs and hours allocation will be reassessed annually. So how are IHSS hours determined? This is probably one of the most common questions folks have about IHSS. During the home visit, the county social worker will talk to the IHSS applicant about their needs and limitations, and also spend time observing them. The social worker will use a numbered ranking system to evaluate the applicant's needs around housework, laundry, shopping and errands, meal preparation and cleanup, mobility, bathing and grooming, dressing, bowel, bladder, and menstrual care, repositioning, eating, respiration, memory, orientation, and judgment. And here is the ranking system the social worker will use. It's a scale of 1 to 5, with a 1 meaning the IHSS applicant can complete the task independently, rank 2 to 4, meaning that the IHSS applicant can complete the task with some assistance, and rank 5, meaning they cannot perform the task regardless of the assistance given. Before we talk through a couple more case examples, I want to talk about protective supervision, which is a really important benefit within IHSS. Protective supervision hours are for people who need to be observed 24 hours a day to protect them from injuries or accidents due to a mental impairment or illness. For example, someone who might wander outside the home and get lost or hurt if they're not monitored. It can be really difficult to get protective supervision hours, so let's talk through eligibility criteria. To be eligible for protective supervision, folks must meet each of these 3 requirements. Number 1 is have a mental impairment or illness that causes functional limitations in memory, orientation, and/or judgment. The second requirement is that the impairments must cause the recipient to experience confusion and an inability to self-direct their behavior so as to keep themselves safe and free from harm. And third, the recipient needs to be observed 24 hours a day in order to remain safely at home. Okay, so let's look at a couple more case studies before we close, starting with Miss Maggie, who is a non-self-directing senior with dementia who has a propensity for wandering away from home. She is already on Medi-Cal with IHSS, and her family has requested protective supervision hours for her. They are concerned without protective supervision, she may wander outside and get lost or harm herself. Unfortunately, the county has denied protective supervision hours. Our questions to answer here are: what can you do to help Miss Maggie get protective supervision hours? And what can you do to help Miss Maggie deal with the protective supervision denial? While Miss Maggie definitely seems like a good candidate for protective supervision, as a clinician, the best thing you can do to help her get protective supervision hours is complete the SOC 821 form if you haven't already. That's a form for clinicians to assess a patient's need for protective supervision. We just went over the eligibility requirements, so any clinical documentation you can provide that shows that Miss Maggie has a mental impairment or illness and is non-self-directing will be helpful to the family in proving she needs protective supervision hours. And then hopefully hearing that a patient was denied an important benefit like protective supervision is a flag for you to remember to refer the patient to their local legal aid organization for legal help and representation in appealing the denial. Okay, and now on to the last case study, which is about Bat and Minnie. Batsheva is in her early 70s and has a recent dementia diagnosis. She has diabetes and also has a hard time controlling her blood pressure. She needs assistance and/or supervision with activities of daily living. She is at risk for falls, needs assistance bathing, and needs help with transportation to or from medical appointments. She can't self-administer her medications or monitor her insulin levels or blood pressure. Bat receives $1,150 per month in Social Security retirement benefits. She often cannot afford her diabetes and blood pressure medications. Bat's sister Minnie is 61 years old and was earning a comfortable living, but has recently had to quit her job to care for Batsheva full time. Minnie is now struggling financially and does not know how much longer she can care for Bat. Our discussion question for this case is, what benefit programs could help Bat and Minnie? So let's start with Bat. She needs help with activities of daily living and also needs help with affording her medications. We can address both of those needs by getting Bat onto Medi-Cal, which will cover her medication costs and also provide her with access to IHSS so she can get the help she needs with bathing and medications and so on. At $1,150 per month in Social Security retirement benefits, she's definitely under the Medi-Cal income limit, so she's definitely eligible. With her income being so low, I would also encourage her to apply for CalFresh benefits to get some assistance with food costs. Moving on to her sister Minnie, who has given up her job to take care of Bat. First, I would think of evaluating her for paid family leave, which is a topic covered in another training session. Another option for Minnie would be for her to become an IHSS provider so she can be paid for taking care of Bat, or she might decide to go back to her previous job once Bat gets her own IHSS provider and no longer needs Minnie to be her caregiver. That's for her to decide, but those are some options for income replacement for Minnie. So that brings us to the conclusion of this training brought to you by the Dementia Care Aware Project. Thank you for attending, and for more information, please visit the Dementia Care Aware website at dementiacareaware.org.